which calls for discussion-based frameworks to support clinicians in anti-racist communication and trust building. The Presence 5 for Racial Justice is an emerging framework intended to support Black patients in getting great care. Presence 5 for Racial Justice incorporates human-centered design and community-based participatory research with input from patients, clinicians, previous literature, and non-medical professionals. In this module, we will be focusing specifically on anti-Black racism to provide strategies that target the unique experiences of racism affecting Black patients. However, our hope is that these strategies are generalizable to a diverse group of patients. The Emergent Presence 5 for Racial Justice, P5RJ, practices include 1. Prepare with intention by reflecting on identity, bias, and power dynamics. 2. Listen intently and completely without interruption, and listen deeply for the potential impact of anti-Black racism on patient health. 3. Agree on what matters most by having explicit conversations about patient goals, treatment comfort and consent, and referral planning. 4. Connect with the patient's story, acknowledging socioeconomic factors influencing patient health and focusing on positive efforts. And 5. Explore emotional cues by noticing and naming patient emotions, and considering how experiences with racism might influence emotions. In alignment with community-based research, this CME was developed by a community advisory board of Black patients and clinicians who treat Black patients. The following scenario was developed by those patients and clinicians, drawing on their lived experiences. In this video, let's consider the practice of listening. As a reminder, Presence 5 for Racial Justice, Listen Intently and Completely includes listening without interruption and listening deeply for the potential impact of anti-Black racism on patient health and interactions with healthcare. Consider the following scenario. You encounter a Black 60-year-old female patient who seems upset, and you begin to address her concerns.
I see you've been having trouble with your back. Can you tell me more about that?
Consider what cues might signal that your patient has experienced racism, bias, or mistreatment.
Well, I've always had pain, but before, I could manage with physical therapy and over-the-counter meds. Now, for the past few days, I've been in worse, constant pain and am having trouble moving. Yesterday, I saw my doctor, but it didn't go well.
What happened at that appointment?
Reflect on the behavior and language you would use to show you are listening to this patient's negative healthcare experience.
I just felt like she wasn't listening to me. When I asked about other drugs or running tests, she interrupted me and dismissed my suggestions. She probably thought I was faking my pain so that I'd get stronger drugs, just because I'm a Black woman. Really, I'm just in a lot of pain and want to feel better.
Consider how you might respond as a physician in this instance.
I am very sorry your doctor was dismissive. We should always take pain seriously. Tell me more about the changes you have been noticing.
The evidence shows that when physicians meet with Black patients, they are significantly more likely to have shorter visits, speak faster, and verbally dominate the conversation. Being aware of your own biases, considering broad differential diagnosis for every patient, and making treatment recommendations based on efficacy instead of convenience can reduce disparities, increasing symptom remission and decreasing chronic impairment. To facilitate the practice of listen intently and completely, sit down, lean forward, and don't interrupt. What does your patient say when uninterrupted? Here are some examples of listening intently and completely. Position yourself to be receptive, listening for your patient's experiences with anti-Black racism. Take note of how individual and institutional biases have influenced your patient's experiences. Avoid making monolithic assumptions about all Black patients. Engage with the specific patient in front of you. Improving care for Black patients requires clinician self-reflection, personal commitment, and institutional support. Incorporating these Presence 5 for racial justice, evidence-based strategies into your clinical practice is one way in which you can make a positive difference in the lives of your Black patients.